The tobacco lobby group FITA previously argued against the ban on the sale of cigarettes, saying that the lockdown regulations were not explicit on tobacco trading. Now, to discuss this further, we joined via Skype by the National Council Against Smoking Executive Director Savera Kalideen. Good afternoon to you. Thank you so much indeed for joining us. I don't know if you may have heard the clip that we've just played now on air by the Minister in the Presidency, Jackson Mthembu, saying that the ban has not been lifted. Rather, there is now some public consultation that is happening.
Good afternoon. Yes, thank you. I did hear what the Minister had to say, but just to put it in context to your viewers this afternoon, when the lockdown regulations first came in place, we didn't have any levels, but we learned this week from the President that was considered level 5. And, there were only a list of essential products that were available for sale, including things like food, like medicines, airtime, petrol, and they added things like essential products for babies and young children. And so what happens now, according to our understanding, is that when we move to level 4, any retail, grocery, petrol forecourt shop, any of these shops will be able to sell all the products that they already have in their shop. So if they have already been selling cigarettes or any other product that up to now wasn't on the essential list, they will be allowed to sell that product. So in a way, this is just broadening of the number of products that are available for sale. Our message, however, is that the harm from tobacco, any kind of tobacco, cigarettes, e-cigarettes or vapes or snuff, as well as hookah, is harmful, whether we are in the time of COVID-19 or not. So, your viewers will probably have already heard us tell them in the past that every single part of the body is harmed by the use of tobacco. And what we've been hearing from scientists and researchers very, very recently, because coronavirus is just about 4 months old now, what we've been hearing is that some people, smokers, who get COVID-19 are more likely to have very serious forms of the disease when they do get it, which means they're more likely to be hospitalized, they're more likely to get pneumonia, and when they do get pneumonia, they're more likely to get a very severe form of pneumonia, and they might need ventilation, when they are in hospital. So they run very, very high risks. Yeah. Compared to non-smokers. But then
if you are aware of the harmful effects of the use of tobacco, why would you then be against the ban of the sale of cigarettes?
So we are not against a ban. Remember, we are in a time of disaster, and the laws have been changing according to what was considered necessary for us to control the spread of the COVID-19 epidemic, so that we could reduce the extra pressure on the health system. So it doesn't mean that a lot of people will not get the virus. It simply means that, the numbers will be a bit more stable and make it easier for the health system to cope with the problem. So this is not, cigarettes are under normal circumstances legal in South Africa. You can buy them. And so one way or the other, the issue for us was much more about informing people about the health harm. And we were also trying to assist people to stop smoking. And what we found is that many people were calling. We run a telephone counseling quit line on 011-720-3145. Many people were calling because they wanted to give up smoking. And we provide them with some tips and support and advice to help them to do that. And for those people that wanted additional support, aside from the counseling that we were providing, we'd also suggested that they might want to buy something like nicotine replacement therapies from pharmacies, because that would give them, if they were addicted to the nicotine, that would give them lower levels of nicotine, but not the harm that they get from smoking cigarettes, because there are many, many chemicals, thousands of them, in cigarettes, aside from the nicotine, which are really harmful to health.
All right, so part of what some of your concerns were really regarding the ban of the sale of the cigarettes was what you call the illicit cigarette trade, saying that it was flourishing, and there was an estimated loss of on the taxes of about 1.5 billion rand a month. Talk to us about that.
So we are the National Council Against Smoking. So we are actually focused on helping South Africans to not smoke or to stop smoking if they do. The information that you are talking about actually came from the Tobacco Association and the tobacco industry, who used this time to make claims that we were losing that kind of money. But in fact, with tobacco use, we lose as South Africans and as taxpayers 59 billion per annum on the harm from tobacco. Most of that money is spent on our health system, treating all the people with various tobacco-related diseases. So we lose 59 billion per annum, and we collect between 13 and 14 billion in taxes. So a lot of what we heard from the tobacco industry and the Tobacco Association during the lockdown, and we are continuing to hear, like the figures that you are quoting now, are completely inaccurate, and they don't reflect what's actually happening. The 59 billion that we're losing all the time is a figure that they don't want to talk about. What they did claim is that we have higher rates of illicit trade during this lockdown. So your viewers might not know that we have, unfortunately, a high rate of illicit trade all year round, and that is for two reasons. One of those reasons is because there isn't proper enforcement and monitoring by the police service of the goods, illicit goods. And you will know that there are many kinds of illicit and illegal goods that are available for sale in our country. And globally, the reason for that is when there's not proper enforcement and when there's high levels of corruption in the country. The second reason is that there is a tracking and tracing system similar to the barcodes that we find on all products that we buy, that we are supposed to have in our tobacco manufacturing process as well. But every time government has tried to introduce that, the tobacco industry has objected. So what we should be asking from the tobacco industry, because globally, again, what we know is most of the illicit cigarettes have been manufactured in a legal tobacco manufacturing company. So what we should be asking the tobacco manufacturers and distributors is how our legal products that they are supposed to be responsible for landing up in the illicit market in South Africa.
All right, so just finally, will you be making submissions on this particular matter to government? The deadline is tomorrow midday.
Yes, of course. We will be offering our comment on the change in the regulations. Yes.
All right, so that's where we'll leave it. Thank you so much there to Savera Kalideen. She is the National Council Against Smoking Executive Director, giving their take on the public consultations when it comes to the lifting of the ban on the sale of cigarettes. Let's take a quick break here on SA Today. There's still so much more to come. Do stay with us.